your party tells you what to vote on the propositions, right?
Well, the parties usually are the only ones out there providing information on it.
Right.
So you have to turn your ballot over in order to get to these wonderful pieces of democracy that are here.
Welcome back to the Hudson Valley 1 podcast, episode number 3. We're keeping things fresh, and we have with us another esteemed member of the Ulster Publishing team, editor Brian Hollander. Welcome.
Zach, how you doing?
I'm doing great. I'm feeling good. Today on the podcast, we're going to talk about the local election. Yeah. We might get into some affordable housing stuff, and then in part 2, Geddy's going to come by. We're going to debate COVID, maybe talk about mental health programs in the area. But let's start off with the election, because that's the big thing that's going on this week. Early voting is happening now.
I predict that everybody who's running unopposed is going to win.
You heard it here first.
I think that there are an inordinate amount of races that are that are unopposed. Woodstock has unopposed races, except for a county legislature race. New Paltz has unopposed races. 5 out of the 9 common council seats in Kingston are unopposed, and that's been populated by 9 Democrats anyway, so we'll see what happens with that. The county legislature has a handful of unopposed seats. I think it's about 6, something like that, and that's probably where that's probably the place where any contests might take place. I think that the races, of course, the race in Kingston between David Donaldson and who's the chairman of the legislature but lost the Democratic primary to Philip Erner. And there's a third candidate in that race. Suzanne Timbrook is running in that race. She's on the Republican line. Erner's on the Democratic line, and Donaldson's on the good government line. And we'll see if this long-time veteran of Ulster County politics, David Donaldson, can pull this one out without a major line on the ballot.
All right, that was a kind of an upset, right, when he was...
Sure was.
Primary, yeah.
Sure was. The guy's the chairman of the county legislature, so if he's going to be running in a primary, he's going to expect to win, and didn't. Lost by a handful of votes to an upstart gentleman who is definitely on the left side of politics.
It's sort of an unconventional candidate. We're seeing a few of those this year.
A few unconventional candidates, yeah. Like Curtis Sliwa down in New York City.
Right.
I don't think there's too many like him up here, but that's where the contests lie. Mostly, there are a couple of town supervisor races in Olive and Shandaken. In Olive, the incumbent Jim Sifranco is running against Mitchell Langbert.
How do you remember all of this? You've been doing this a while, I guess.
Yeah, when you're trying to get together articles to put in the paper or online, you end up reading pretty closely, and kind of sticks in your head, and the politics have always had me enthralled anyway. I had my own stab at it a few years ago, and I like being on this side of it better.
I can see that. Well, it seems like you're not the only one with so many people running unopposed. Where are the candidates to oppose them? There must be a lot of sad Republicans and or Democrats at home with no one to represent them in local government.
Well, Ulster County has had quite a turn in the last 30 years or so. And it started in places like New Paltz and Woodstock, where the Democrats started outnumbering the Republicans. For hundreds of years, Ulster County has been Republican. And the Democrats had very little chance when I first came to Ulster County and lived up in Woodstock. There had been one Democrat elected supervisor of that town before, and
hard to imagine.
And he switched parties while he was in office.
Wow.
So, but starting right around the late 1980s, things changed, and the Democrats hold a serious plurality in Ulster County over the Republicans, and of course the independents. There are more independents than there are Republicans, so it's all pretty crazy. There's a bunch of ballot propositions that people are unaware of that maybe we can go quickly over them and make sure that people understand what's going on.
Let's do it, because I haven't really looked at it, so this will be
right.
You can tell me how to vote, Brian.
All right. Well, Proposition 1. These are propositions that are going to be on the ballot for everybody, and then there are some that are specific to town. So we'll go quickly. Proposition 1 is about enacting redistricting reform. Ulster County had an interesting process where it changed its districts a few years back from at-large districts with several legislators overlapping to a 23-person legislature with single-member districts, and they had a bipartisan commission that actually worked to draw the districts. That's always the big bone of contention. That's always where everybody wants to get an advantage, where all of the seats are hacked out, and all those crazy squiggly lines on the map that show where a district up here will be included in a district down here, just connected by a thin line.
Gerrymandering, right?
Yeah. Gerrymandering.
It's like looking under the hood of democracy and seeing one part of the thing is just completely broken, because you look at any map of these districts. And
right. So this redistricting reform is statewide, and it's supported by the League of Women Voters, and I think that it's going to make it a little more, make it a little easier for people to control, for different parties to control it. It's going to fix the number of state senators at 63, which is where it is now. And it's an interesting proposition. Proposition number 2 provides the right to clean air, water, and a healthful environment.
That's a no-brainer.
That's
right.
Yeah.
I mean, like, is there someone out there that is just so biased that they're like, why do we have to vote on this?
Right. Well, but if you do vote on it and it becomes part of the state constitution, then
money is going to be spent.
Then it's open to challenge in court.
Okay. But what is it actually purporting to do? That's just saying that we have to provide this.
Everybody has the right.
Human right, yeah.
It's a human right. Proposition number 3 would allow same-day voter registration. This is a controversial thing all over the country. It's a controversial thing.
And why is that?
I can't imagine why. Same-day registration, I know that the boards of elections see all kinds of clerical problems with it.
Okay. I guess from the right side, they would be concerned that people who aren't eligible to vote would be able to slip in somehow?
Well, anybody's concerned about that, the people who aren't eligible to vote. But there's another amendment here that allows for no excuse absentee voting.
Because now you have to actually provide some.
You got to tell them, I'm ill, I can't get there, or I'm going to be out of town.
How hard is it to lie currently? Are they going to check you out if you say I'm on vacation?
All of the investigations, as all the investigations into the last presidential election show, there is very little voter fraud in the United States.
You can't get people to vote. Period.
Well, it's hard to get people to vote, and this one has a chance of being an election where too few people vote, because of the lack of contests and the lack of marquee names out there. Anyway, Proposition 4 allows for no excuse absentee voting. Proposition 5 is one where the civil courts would be allowed to hear claims of up to $50,000, and they're only been allowed to hear them up to $25,000 at this point. So if they hit $50,000 limits on this in the civil courts, it means that they can take some of the load off of the higher courts and distribute it a little more evenly.
Okay. Hard to tell whether that's a good or a bad thing as a layman here.
It's hard to tell, you know. You'd have to see that. Yep. Proposition 6 is utilizing funds designated for payroll expenses within the county budget. This is an Ulster County charter amendment. There's a way of people who make budgets sometimes will put lines in the budget and fund them for positions that they may or may not intend to create. And if they don't intend to create that position, then that money has already been collected in taxes. It goes into a fund balance or a capital fund somewhere, or you can use it to shift around. This would restrict that, and that's not necessarily a bad thing.
Right.
Although, as a former town supervisor, you appreciate the flexibility that you can have with funding, but there's a lot of ways to deal with it, and that's just not putting the truth on the line if you're not really intending to fill that position.
Right.
And making sure that you have the dough.
And who comes up with these ballot propositions? What's the process by which they get put on the ballot?
They get put on the ballot by petition. They get signatures the same way that you get a candidate on the line. They can be put up by different parties. They can be put up by the state legislature. These amendments to the Constitution are put up by the state legislature.
So I couldn't go around and collect 10,000 signatures and put something on the ballot. It would have to be an elected official.
I'm not clear about that.
Okay.
We'll have to get back to you on that.
Well, if we get enough podcast listeners, maybe we can change the world.
Yeah, maybe we can. There's a few local propositions here. The town of Marlborough wants to change the terms of office of the highway superintendent from 2 to 4 years. That's been done in quite a number of towns. People see the highway superintendent as not being a particularly political position.
Right.
It's a position of, can do, get out there and do the work. And that's perhaps a pretty interesting one. Town of New Paltz voters are going to vote on whether to increase the budget of the Elting Memorial Library by $100,000 up to $656,000.
I gotta say, the library was a lifesaver during COVID, and they switched to just keep putting the books out there for you. You order online.
Yeah.
So I'm not saying yes or no, but I'll give 1 point to the libraries.
Give 1 point to the library. All right. New Paltz Village voters have a volunteer firefighter awards program that allows some pension money to go towards volunteer firefighters. They want to raise that from $700 a year to $1,200 per vol per each calendar year that they've worked. Town of Olive voters are asked if the yearly operating budget of the Olive Free Library should go up, and that's something that they do almost every year. They want to increase it from $148,000 to $168,000. Shandaken also has 2 libraries, and they want to increase the amounts that those libraries get. Town of Ulster wants to decide if it should have a town office of comptroller, somebody to watch the money in the town of Ulster. Traditionally, the supervisor of a town is the guy who is the chief financial officer, so he's the guy who makes the budget along with his advisors, and they present it to the town board. The town board usually has a public hearing and passes it, and usually that takes place right after Election Day, because they have a November deadline for getting the budgets done in the towns, and they usually wait until after the election because so it doesn't become an election issue,
right?
Which could be good or bad. Who knows? And the town of Woodstock, my town, is going to vote on a $1 million bond issue to renovate the Como property offices, town offices. It's an old mansion up on the top of the hill on this beautiful, pristine 76-acre property, and not particularly suited for town offices, and it needs some renovation. The plan to add on to this old mansion is controversial. They've had quite a few meetings about it. People yell, as they will, in Woodstock about the design of it. Everybody wants something to get done. So we'll see if this bond issue passes for $1 million. The whole project is $2.99 million. The town has $1.9 million in its capital fund, capital reserve fund, to put towards the project. So we'll see.
And I just saw in the paper that a town historian is working to try and get a historic designation.
That's correct. Yeah, some people feel of course there's resources that come along with an historical designation. So they could get some money to help with the project if it does. People are worried that the design of the renovation, the design of the addition, will disqualify it from being a historic building. The town historian says that that's not certain at all, and that adjustments can be made down the road. So
seems like an interesting slate of issues. Some of them are easy to understand. Some of them are pretty much inscrutable. But the way this usually works is your party tells you what to vote on the propositions, right?
The parties usually are the only ones out there providing information on it.
Right. Them and us, right?
Yeah. Yeah. So you have to turn your ballot over in order to get to these wonderful pieces of democracy that are here. You have to turn the ballot over to see them and vote on them. So hopefully we've provided a little bit of light on that.
Yes, definitely do your part and vote. And one thing I wanted to ask you, because I've been talking to some of the candidates this year and getting a little more informed, obviously reading the paper a lot more. You get this image of candidates going knocking on doors, canvassing, getting individual voters. But what I've come to understand is that voting is really driven by cliques of people, groups of people who all get together and coordinate. Maybe it's around politics, but it doesn't necessarily have to be. One of the candidates was talking about a clique of fake wrestlers that he had just, secured. So that to me doesn't seem particularly democratic. We see that there aren't a whole lot of individual voters, coming out. It's more of these groups. So how could we maybe move to a more equitable, system of where we're not having these voting blocks, but we're actually having individuals voicing their opinions?
Well, it's a traditional thing to gather constituent groups of people. That's where people congregate. That's where you find them. You go to a Rotary meeting or a Lions Club meeting or something, and you talk to the people there. And it's true that groups are pressured to bend one way or another and all stick together, and that's how you get elected. That's how you put together your coalitions.
And there would be reciprocation there, right? So maybe the wrestlers get a new wrestling ring.
New wrestling.
I understand that things have to work a certain way, but it just doesn't strike me as possibly the best way to go about electing officials. I think that what seems to be the weak link is, like you said, people are just not informed about what's going on. They're too busy with their own lives and trying to get by just to sit down and read an entire article on propositions, but it's in their best interest to do so. It is,
but you get on the phone, you talk to your neighbor, you say, "Did you see this proposition? What do you think of that?" You got to gather the votes from somewhere.
Right.
You have to go out and you have to talk to the people. You have to meet them. If you can meet 10 people instead of one person, then maybe you got a chance of getting 6 of them to vote for you or something like that.
Right. And that works both ways. I've talked to a lot of activists, whether it's for housing or whatever locally. And, their message is clear. We need to talk to our neighbors. We need to, congregate and start discussing these issues, and that's how things start to happen.
Government works best when there's participation of a lot of people.
Right.
So you need to be able to gather as many as you can.
And this segues perfectly to the next topic I wanted to discuss, which is affordable housing. And recently we reported on a meeting in New Paltz where I think 7 people showed up on the tenant side, 7 people showed up on the landlord side, and they just couldn't find any agreement. And this has played out in multiple town board meetings. The 2 main things I'm seeing are a good cause eviction law, which I think the intent of that is to prevent landlords from just kicking out tenants and raising the rent, which has happened here and there.
Sure.
And then there's also, I believe, an Airbnb style, something to address that, which has to do with needing to live close to the Airbnb, and that's the intent there is to stop the Airbnb-ification of housing. But it seems like local governments can't really make a whole lot of progress, and in part because there's this impasse. And my question is, when there's so many more tenants out there than landlords, why can't we get even the smallest thing passed here?
Well, it's tough. You have 2 sides to the story, and both are essentially correct.
Right.
They both have a really good case. Where's the compromise? The compromise comes in being human and talking and having this bargain between the landlords and the tenants. And it can, in some cases, it's a contract, a lease. In some cases, it's a handshake. In some cases, it's who knows what. You have situations where people are long-term living in a place that they've rented, and it's always been reasonable and it's always been a good relationship, but the landlords are getting old and they want to sell their property and move to Kuala Lumpur or someplace, and somebody new comes in and they look at the building and they see, my God, I got to make a lot of repairs here. I have to do a lot of work to this place. This has been neglected, and how do I do that? How do I gently deal with a tenant and get them to understand the situation? So it's a very difficult situation right now. The New York State has the eviction moratorium in place until January, and we'll see what happens after that. I don't believe that there are a ton of predatory landlords out there just waiting for that day to pounce and raise the rent and evict people. I hope that's not the case. But there does need to be some recognition on both sides. And is there a law that can make that happen? It's very hard to see what can be crafted that will help in this situation. Do you put a percentage ceiling on what you can raise rents?
Right, because a lot of people cite in New York City, there's rent control there. Why wouldn't that be applicable here, where half the people are from New York City? Anyway?
But in New York City, it's always a contentious process.
Sure.
The rent control process. So I don't know the answer. The answer is that humans have to come together and talk about this stuff. Landlords and tenants have to talk about this stuff.
Yes.
Maybe tenants have certain amounts of rights after they've been there for a certain amount of time. That could do it. As far as the Airbnb is concerned, that's a horse that left the barn before everybody was able to regulate it.
Right.
Society moves so fast in so many different ways that the technology grows, the ideas grow, and legislating it is a much slower process. So there are some Airbnb laws out there. Woodstock has one, but of course Woodstock didn't get theirs until there were just hundreds of Airbnbs out there already, and everybody knows what the issue is with that. The issue is that they are taking away longer-term housing from communities and affordable housing in communities. That's why we got to look to somebody like Rupco, which has a bunch of interesting projects going on right now. They're doing the Alms House here in Kingston. They're talking about the old Ramada Inn up there, making units out of that. The county is looking at the old jail up there to make it into affordable housing, and they're looking to build communities out of them too. They're looking to have amenities within those places. That's the kind of thing we need more of. The Rupco project in Woodstock is a wonderful example that was opposed for 10 years, and Rupco persevered and got that through, and that's been a big success up there. But if you've got thousands of people and you're creating hundreds of units, you've still got a deficit. So you've still got a homeless problem. You've still got not enough places, and the supply and demand means that the rent goes higher.
Yeah. I mean, in my age group and amongst my peers, there was kind of the separation that happened during COVID, which is either you had a home or you went and you bought a home in the last possible window of getting one.
Right.
Or you're kind of now screwed and kind of in a position where you're going to have to move out of where you live in order to, and that's just my peer group. I mean, there's so many people who have already left here because they just can't afford to stay here, and this is something that's happening across the country. It's so complex. There, like you said, there's supply issues, and sometimes I think, what would we do without Rupco? Where would we be?
Well, we'd be in a tough place. Yeah. That's for sure. That's for sure. People talk about how things change, but things are constantly changing. People talking about the gentrification of Woodstock or something, or a place like that, and yet we look back in history and we see in the early 1900s, when the artists came to Woodstock, the townspeople were like, "Who are these people? They're coming in and they're just taking over and changing the whole town." And then when the hippies came in the 60s, who are they? Now we're looking at them and we're still going, who are they?
It's a very personal thing. I remember returning to Woodstock after not being there for a while, and I grew up on the Woodstock Green, as many kids my age did, and maybe it wasn't the best place to grow up, but it was an interesting place.
Yeah.
And I returned, and everything was real estate offices. I remember for a 2-year period there were like 8 real estate offices open there, yeah. And it makes me as sad as sitting here across from what used to be BSP and is now like an empty, unused, one of the best buildings in the city. All that potential just kind of squandered in the scurry for profits and development.
Yeah, well, it's a boom or bust society, though. We've seen the down times too, after 2006, right. 2007, the mortgage scandals of those days, and the market. I know a lot of real estate people who started looking for work at that point too, and there was another one in the early 1990s. So it goes in cycles. It goes in boom or bust, and and people who've moved up here, they had a grace period last winter. But if it's a good winter up here, where the temperature hits below the 0 mark for a couple of weeks. And the snow piles up to your waist, and it's the big equalizer. It's the big EQ. Other people think, well, I'm going somewhere where I can get plowed out.
That's right. Snow is the great equalizer.
Yeah.
We'll climate change is good for something, I guess. Well, speaking of cycles, just to wrap up, the election cycle wraps up next week, so I'm sure we'll have a lot more to talk about.
Yeah, we'll have some results.
So definitely stay tuned to the paper, the podcast, and the website. And until next time, thanks, Brian.
Zac.
We can do a COVID shake. This has been the Hudson Valley One podcast, and on the next part, we're going to talk to Geddy Sveikauskas, the publisher, about long-term COVID and issues of that nature. So stick around. welcome back to the Hudson Valley One podcast. On part 2 here, I'm joined by Ulster Publishing publisher and Big Cheese, Geddy Sveikauskas.
Just call me Provolone.
Provolone over here. Are you Italian?
Mezza.
Okay, speaking the language. And this week we're speaking the language of health. The Hudson Valley Health special section is out, and there was an interesting article in here that you wanted to talk about something that I don't think gets a lot of coverage, really.
Yeah, the subject is interesting. I wrote about long COVID, both hospital systems, Nuvance and the Kingston Hospital owner have programs for post-COVID, that is, people who have long COVID symptoms of all kinds, and like when there was all this fuss about the infected bugs and a disease discovered in Dutchess County that never existed before, when you have varied symptoms, you really kind of your first idea, well, it doesn't fit, so there's nothing wrong with you. Mm-hmm. And people that's unfortunate. But it turns out that about 20 to 25% of people have some symptoms after they have COVID, and that a certain proportion of them, maybe 40% of that, can be quite serious. And as I say, the symptoms are so varied. It can be a loss of hair. It can be a loss of sight. It can be a loss of you just feel tired and logy all the time, or it could be you have various other symptoms, pains of the joints, etc. But they're very, very numerous. You can't sleep. They're very numerous symptoms, and so they found when they had so many people having it. I mean, there were 19,000 cases of COVID in Ulster County in the last 19 months. Mm-hmm. They decided that there were enough to have a program for it, post-COVID program. So about a year ago, the one system started it, and the other picked up on it a few months later. So they have, and there are more than 1,000 enrollees altogether in the two programs, and that's quite a lot considering there were 0 19 months ago.
I imagine, yeah. So this is obviously a novel coronavirus, so it's new, and there are things that we don't understand about it yet. How are they navigating this new field, and what kind of treatments are they providing to these long COVID patients?
Well, basically what they're doing is they are checking them out. It's interesting the way that the two systems do it differently. The Health Alliance people do an interview and a physical checkup. The introductory program at Nuvance, which comes out of Northern Dutchess Hospital at Rhinebeck, does it over the phone. So the initial contact is just simply you call up, you talk to somebody, and I said to the doctor who's handling that, doctor, isn't it rather strange to just have not even examine the person? And she said, you'd be surprised what you could find in 35 minutes or 40 minutes or an hour of talking to somebody.
Sure, yeah.
So then there's the physical examination, and then they give them a navigator, the person who says, well, you've got this symptom, let me get you in touch with this particular specialist or that specialist. Mm-hmm. And because the symptoms are so varied, the number of specialists are quite large who could be possibly involved. And then they follow it from there. They go to the specialty, they key in the primary care provider of each person into the system, into the treatment, and they do it. And sometimes it doesn't require any treatment. The person, the symptoms just go away, and sometimes they're persistent. And because it is so new, we've had to kind of invent a way of dealing with it. And I found that because the two hospital systems, Health Alliance and Nuvance, are sort of dominant locally, I thought it was quite it was worth doing. COVID has a big shadow as well as a presence.
Yeah, one of the things that's really surprised me during COVID, we've had these amazing medical advances of creating these vaccines on such a short time scale. Very complicated work used to take many, many years. Now it's very fast. So we don't understand long COVID very well. You have to imagine there has to be a lot of data sharing and a lot of different treatments going on at different places. Yeah. How does that all kind of come together to?
Well, both systems are quite aware of what's done in hospitals with much more resources. The New York hospital, Mount Sinai, has a very big program, and others do as well. So they, in a sense, we're not. There's probably very little original research happening at this point locally, though that will come later. But it's the newness of it. The whole struggle about the vaccine shows wouldn't happen if it was something that had been around. So if it was a measles or mumps thing, you deal with it. The kids get those shots all the time without anybody thinking about it. But because this is new, people say that there's something wrong with it. It's so mixed up with the political mess this country is in.
Well, I think there's a lot of people who want to equate this to things that happened in the past. They equate the vaccine to previous vaccines. They equate the virus, on the other hand, let's say, to a really bad version of the flu, on the two poles of opinion here. Yeah. And there's a lot of misinformation and confusion around what's actually going on. And I think part of that is because we've seen sort of a lack of coordination of efforts and a lack of, for example, long COVID. This is the first I'm learning about, treatments being available. And I'm very curious if traditional methods are being used or if
I think they're mostly more traditional methods. As we find out more about say, for instance, Mount Sinai says, we have a treatment if your hair is falling out to prevent it from falling out, then the news spreads very quickly in the medical community, and they would adopt that locally. But this is a small area. The New York City is where not only the doctoring takes place, but the research that goes in and the expertise. Mm-hmm. So medicine is an area where people learn new operating techniques, new anesthesia things, new everything. And it spreads gradually to the hinterlands, which is where we are, regrettably.
So they're following the science on down the line.
Well, sort of, yeah. But when you say following the science and you're dealing with something new, you're dealing with people's suspicion. There's something, they're going to have vaccines for kids. Now, you have kids, you have a little kid, somehow, you don't, even if you were perfectly happy getting an injection yourself, you're a little cautious when it comes to your kid who's going to scream and yell. And you're not quite sure whether the dosage is right. You think up all kinds of excuses as to why,
right, because that's one of
could cause a problem. Your kid is perfect. This could make it imperfect.
Right. Because, one of the most basic, obvious things should be this is a very new vaccine based on new technology, and it is not comparable to past vaccines in its composition or in the length at which it's been studied. When my daughter had to get her vaccines, we spaced out the program, but we didn't, not get her the vaccines because science over long periods of time has proven them to be safe. And we have every reason to believe in the short term that the vaccine is generally speaking safe, although there's been a lot of underreporting.
That's the rub, generally speaking, yes.
Well, so everything is generally speaking safe. Driving a car is generally speaking
but safe. Something new is more generally speaking than something old.
Right.
And that's, I think, what's going on here, that somehow when we make change, whether we say we follow the science or some other reason, we're doing something we didn't do before, and there is a suspicion. What if it doesn't work? What if it's wrong? And what the hell do they know? It's an opportunity to use science not as something that helps us, but as a magnet for some kind of unseen evil.
Right. Well, the science cannot be followed in the sense of a monolithic truth that is, dropped down. It's constantly evolving, and I think one of the reasons why people, may choose not to get the vaccine, or may think that masking up is kind of an invasion of their privacy and not effective, is because we've been told by authority figures varying things. Masks are good, masks are bad. Or Joe Biden himself even said, I will absolutely not mandate this vaccine. And then a few months later, it's being mandated, and hundreds of thousands of people are losing their jobs, can't put food on the table because they are standing up for their own personal freedom of choice in their health matters.
Yeah, well, New York State picked up on what Biden said, the change in policy, and said, okay, all health providers have to be vaccinated. All companies that employ 100 or more people, everybody has to be vaccinated. And then not just the people in hospitals, but then, well, what about nursing homes? Same thing.
What's the rationale behind that, do you think?
Well,
what does that accomplish?
What it does is it lessens the incidence of COVID. That's what happens. That is, if you are vaccinated, you're less likely to be able to infect other people. Mm-hmm. Therefore, everybody's less likely to die. So, would you rather be in a nursing home where people are saying, "Well, you can get vaccinated if you want or not"? Very often, as many staff members are catch COVID as people in the nursing homes.
Sure.
So it just makes sense, and so therefore they say, well, they're going to quit. They're just not going to do it. Some people, the job isn't worth it. To hell with it. But when it came down to it, less than 2% of people in the hospitals didn't get vaccinated or had a good reason not to.
In the local hospitals?
Yeah.
Okay.
And nursing homes, the same thing happened. They said, well, you pay people $14 an hour, and you expect them to continue working if it's against their principles. But it turned out that most of them too got vaccinated when they had to. Mm-hmm. So it's this mixture of politics and religion and science that gets us into trouble. If you want to say, well, what places have the worst outbreaks of COVID? It's the Trump states, practically universally.
Well, I mean, at different times there's been different levels.
Yeah, but
the problem, though, to get back to the science aspect, there you can one day read a study coming out of Israel that says, boys who take the vaccine are more likely to get myocarditis, heart issues, though they do often go away, they're more likely to have a negative side effect from the vaccine than they are to be hospitalized for COVID.
Yeah, well,
and then the next day you'll see something that completely contradicts that. So how are we to make sense of what's clearly competing interests trying to influence our behavior? And don't you think that there should be some sort of area for personal choice and freedom up until a point?
I think what you have to understand is the probabilities.
Yes, agreed.
That is that if you could get this very rare heart disorder from taking COVID, and actually people have it, then you say, what if I'm the one? What if my kid is the one?
Right.
It's just like people have phobias about being absolutely pure, so therefore they will not be struck down by God.
Right.
And lo and behold, if you look at it, a few people are struck down by God, and yet the vaccine saves many more people than it would have than get struck down by God.
And if we're looking at the numbers, within a certain age demographic, and certainly children have such an incredibly infinitesimally low level of hospitalization and death from this disease that I think a lot of parents are, and far more than I think you appreciate, are just questioning, why am I giving my child a just out of experimental trial vaccine, which we have no long-term data for on how it affects children.
Yeah, but we have short-term data for millions of kids.
Just feels like we should be a little more careful with our kids when it comes to
of course.
Down.
Yeah, I think that's the natural instinct, and it's the correct one. But they're giving a quarter dose to kids.
No matter if they're 3 or
3 to 10. 10.
I'm not a scientist, I'm not a healthcare person, but that to me sounds crazy. There cannot be a one-size-fits-all for that age group, but apparently the medical professionals are telling us that there is.
Well, they say it's effective, that a quarter dose is effective for a small person.
Right.
Yeah. And kids are, kids are the future. You don't want to risk it. There's the natural adversity. But if you look at it and you say, okay, you line up every kid in New York City, and you take a photograph of them, and you say, 2 of them are going to get this heart disorder and die from it. You see this sea of kids, almost 1 million kids, and those 2 are picked out. Would you give your kid a vaccine or not? It's really a question.
Yeah.
And some people, I think, my instinct would be no. But when I think it over and I look at that sea of faces and say only 2, yeah, maybe I'll take a shot because I don't want my kid dying of COVID.
Right. And if it's only 2 who are dying of COVID, and we could say the data supports that the flu is more deadly to children than COVID, so should the flu vaccine be mandated in children? By that logic, it should, right?
If
you can look out on the sea of smiling faces, and more of them are going to die of the flu than COVID. So I don't understand the logic of making a just out of experimental vaccine, putting that into children when we're not mandating a flu vaccine for children, which is more deadly, as far as I have seen in my research. But again, this is also the problem with what's going on. I am not a medical professional. I've just read an article here, and I'm open-minded. I could be wrong.
If you for the last couple of years, the flu has been very quiet. It hasn't just killed only a handful of people, vaccinated or not. So there's really, the vaccine is sort of an extra, but you never know, because 3 years ago there was a big outbreak. So it's almost like a trip to Vegas.
Well, my last job, podcasting job, was for a poker training site, so you better bet I know the odds. So, I mean, we'll talk about COVID, I'm sure, in future podcasts, because it's the news gift that keeps on giving. That sounds so macabre and dark. It's a horrible tragedy that we're having to deal with every day, and it affects all corners and facets of our lives.
Yeah, and folks, don't hold it against Zac here for having done a poker site in his last job. This is a sort of a crap game too, but it's
what's more of a gamble than working for a newspaper in 2021? Right?
There we go.
I just want to wrap up this conversation with a slight change in subject, but not really, because we're talking. The science always changes, and I was reading an article this morning that mental illness is being added to the list of risk factors for your higher risk for when you get COVID. If you're mentally ill, which I found funny because of the COVID-19 lockdowns. Not funny, but kind of ironic. The COVID-19 lockdowns has created a mental illness crisis in our area, and this locally has never been more true because of the lack of the mental health care and drug addiction care facilities, which has been a hot topic in this area for a while. So are we going to see that addressed?
Well, I think immediately of this paranoid schizophrenic talking about his symptoms. How much of it, how do you interpret and use that so that information, so that you can help the person where they're seeing devils under the bed. it's very hard. But I think it's in general it's a good thing that we are paying more attention to mental health problems of all kinds, but unfortunately it's going to take a greater expertise than we seem to be willing to give it to turn things around there.
It's a very good point.
It's when I was a kid, I used to go to I was involved in a study in New York City about mental hospitals, and I went to the houses, basically these huge hotels for the insane, hundreds of people, thousands of people in each one, and interviewed them. And what we're doing now is really a whole world away from that kind of thing, but we still haven't made the next step, which is that every human being has a certain number of rights, and we extend those rights to include health care and care for the mentally ill. And until we get there, we live in a world where you never know whether your treatment is a blank or a real bullet.
Right. Yeah, so someone in my family worked in drug rehabilitation in this area for quite a long time, and same experience there. So please, if you're watching this podcast, you're listening to this podcast, consider that and think if you can do something to help, because part of the reason why we're doing this podcast is to let you know what's actually going on the street level in your area, so you can get involved and not just informed, but involved, right?
Amen.
Amen. So get out there, take care of your health, pick up a Hudson Valley Health on newsstands this week, and until next time, thank you, Geddy.
Thank you, Zach.
We'll be talking about COVID more, I think. We don't see eye to eye, but that's what makes a good podcast, right?
Okay.
Take care, and thanks for listening to the Hudson Valley 1 podcast.